My name's Katie Deming. I'm a radiation oncologist and founder of Make Merry. And today I'd like to talk to you about the side effects related to radiation for breast cancer. The most common side effect of radiation for breast cancer is skin redness. And it's a lot like a sunburn in that the skin will get red and it can feel sensitive or tender, just like a sunburn does. And that skin redness usually starts in the third week of radiation. So it's important to note that actually you may not notice any skin changes for the first couple weeks of treatment, and that's totally normal. At the end of the third week, it's usually very light pink, and then it'll continue to get red throughout your treatment. Or if you're having just 3 weeks of radiation, it'll peak at about 5 days after the treatment is finished. And I think this is something that's important to note, is that your skin redness is a cumulative side effect associated with radiation, meaning it builds up over time. And so you will notice that the worst part of the skin reaction is actually after you finish the treatment. It usually peaks at 5 days, and then at 7 days it's starting to get better, and then by 14 days it should be tan, and then the tan will fade. And so the side effect of the skin redness is usually mild to moderate. Most women report that it feels like they were out in the sun without sunscreen for 2 to 3 hours. It does not peel normally, but there are some cases where you may be getting more dose to the skin, and your doctor can explain whether he or she expects you to have skin peeling. Another side effect is a rash that can be like a bumpy acne over the breast. And it tends to be actually in the middle, kind of upper portion of the breast, but can be really anywhere. And that's called folliculitis. And it's irritation of the follicles in the skin from radiation, and it can be itchy. There are a couple things that you can do about this. One is you can use hydrocortisone cream for the itching, but the truth is you really don't need to do anything, and it will go away on its own. But the most common mistake that I see patients make is that they see the bumps and think, oh, I'm not putting enough cream on, and they slather it with a lot more cream. What that does is actually it further clogs the pores and can make the rash worse. So my recommendation is just to let it be, and actually sometimes I have my patients stop using the cream in that area for a couple of days to dry out, but definitely don't start applying more cream if you develop a rash over the breast. The other side effect related to radiation is fatigue. This is usually mild. Most women can work full time and do all their normal activities during radiation, but by the time they get dinner on the table, they're just done. It's like head down. So you can, do all your normal activities, but I think planning that in the evening you're not going to want to fill your schedule with a bunch of extra social activities is probably a good idea during radiation. The other thing that is helpful for most women is to try to get about an hour more of sleep at night. That can help with the fatigue, as well as exercise. Exercising during radiation improves fatigue related to treatment, and women actually report they feel better if they're exercising during treatment. One other side effect that you may note during treatment that might be surprising is neck or back pain. And that's usually because of the table that we have you lie on for your treatment. It can be quite uncomfortable to lay on this really flat table with your arms above your head. And a lot of women notice, gosh, my neck is starting to hurt or my back, and it's really just related to the treatment table, and it should improve after we finish. But that's something that if you notice it and you think back, oh yeah, it did hurt while I was laying on the table, that it may be just related to the treatment position. And then the last side effect is sore throat. So you would only have this if your lymph nodes are being treated with radiation. If we're treating your breast only, you should not have a sore throat. But when we treat the lymph nodes, they sit right next to the neck, or they sit right next to the throat rather, and you can have some soreness that develops in your throat. This also develops usually around the third week and can peak about 5 days after treatment. Should be mild and usually can be treated with Tylenol or Aleve.